So without further ado, I want to dive into the topic of antibiotic resistance. It's a major, major health threat. As a matter of fact, the CDC, the Center for Disease Control here in the United States, claims that it is one of their top 7 big bullet items for the year of 2017. In other words, this is one of the greatest threats to the United States as recognized by the Center for Disease Control. So it's something that we really, really need to talk about. It's a conversation that's long overdue. Let's talk a little bit about some of the statistics associated with antibiotic resistance. I think if you know the numbers, you'll understand the dangers. So this is, again, these are statistics from the CDC, not necessarily statistics from Dr. Osborne. These are not my statistics. These are CDC direct. So at least 2 million illnesses annually diagnosed as antibiotic-resistant types of illness. Now, this data also includes fungal infections, not just bacteria. We have 250,000. So let me back up just a minute. We've got 23,000 deaths from antibiotic-resistant based diseases. And one of the top in this category is something called Clostridium difficile, which is a type of bacterial infection, and 250,000 illnesses from C. difficile, 14,000 deaths. So you can see a lot of these deaths arising from just that one particular type of infectious bacteria. So very, very important that you understand this antibiotic resistance is not a small thing. 23,000 deaths a year is not a small amount, and the problem is getting worse. The problem is escalating. So again, antibiotic resistance, top of the list. So where does it start? How does antibiotic resistance begin? I want to push another picture up for you. You can check this out, this diagram. As a matter of fact, let me this problem can happen. Very, very important that you understand it, because it's very important, and understanding it, it's very important in the action that you can take, okay, in order to prevent this and in order to resist this, in order to protect yourself from it becoming a big problem in the future. So let's see here. Let's talk a little bit about, again, who is at big risk for this problem. In essence, here's some of the people that we see that are in the highest risk category. It doesn't mean that not everyone's in the high risk category or can't be in the risk category, but these are the big ones. And I'm going to talk a little bit more in depth about this here in just a minute. But those people that are going through cancer chemotherapy, obviously many of the chemotherapies wreck the white blood cell counts, and so person's white counts can hit the floor, and then they can pick up infections quite easily. So cancer chemotherapy patients, they're in and out of the hospital, and those chemotherapeutic agents oftentimes lead to infection that requires IV antibiotics. And so this is just another way, and not just the cancer patients being at high risk, but cancer patients at being high risk for exposing others to antibiotic resistant types of bacteria. Complex surgeries, it's not even really just complex surgeries. Anytime you go under the knife, generally speaking, if you're even in an inpatient environment, a lot of times they will IV the antibiotic directly into you as a precautionary, and that's just a standard in many surgical procedures. And so again, if you've gone under the knife and you've had these IV antibiotics and knocked out your normal flora, you have that potential for a greater degree of high risk for the development of antibiotic or antibiotic resistant bacteria. And then there's, of course, diseases. Rheumatoid arthritis is the one. And again, this is from the CDC. So what I'm showing you, a lot of these diagrams are directly from the CDC's latest report on antibiotic resistance. But rheumatoid arthritis is not the only type of arthritis. Really, we could categorize, this category. We could say people with autoimmune disease. So lupus, rheumatoid arthritis, scleroderma, dermatomyositis, Graves' disease, Hashimoto's. many of these types of autoimmune diseases, depending on how they're treated, many of them are treated with immune suppressing medications like corticosteroids, prednisone. Many of them are treated with immune suppressing medications like biologics or disease modifying anti-rheumatic drugs. And so the immune systems of these individuals are more compromised, making them more predisposed to developing an infection and then subsequently receiving an antibiotic to treat that infection as a result of the drug treating the disease. And then you have, again, other people, end-stage renal disease. These people are at greater risk. And then organ and marrow transplants, because, the medications being used in organ and bone marrow transplant patients are designed to suppress the immune system to prevent a rejection of the organ transplant or the organ replacement. So, again, these are, just high-risk categories for people who could potentially put themselves or have themselves into some major danger. So, let's talk a little bit about what we can do to prevent this. So now that we kind of know how antibiotic resistance begins, what can you do to fight it? And looks like we've got here. All right, looks like we are. Just checking a few of you, maybe it looks like a few of you are saying that I'm coming in and out. Chime in right now and let me know if you can hear me loud and clear. I want to make sure that this information is getting to you and that we don't need to restart the feed in order for it to come in. So looks like Janine is coming in. Can hear me okay? For many of you, it looks like it's frozen. So let's see if we can't chime in and let me know if I'm coming in loud and clear. Okay. All right. So looks like I'm coming in clear now, and then it's working okay. So again, let's talk a little bit about what we can do to fight. Oh, thanks, Al. Okay. What I can do, or what we can do to fight antibiotic resistance from becoming a major problem. So number one of the biggest things that we can do when we go in, if we suspect that we have an infection, probably the most important thing that you can do is, if your doctor's testing you, or at least talking with you in that initial appointment, generally they'll do some kind of a physical examination. They'll look in your eyes, they'll look in your ears, your nose, your throat, listen to your chest. They're looking for symptoms and differentiating factors between a viral and a bacterial infection or other types of problems. And so first and foremost, if you go into your doctor and they don't even do an exam, you should have red lights in your head going off, like red warning that if that doctor's not putting a hand on you, not listening to you, not looking in your sinus cavities, et cetera, not trying to really ascertain what kind of infection that it is, that's a good sign that you don't have a very investigative doctor, and that's not good. We don't want that. You want somebody who's going to be a Sherlock Holmes on behalf of you. So you want to make sure that the doctor's doing a full examination. And so they should be using those tools that you see on TV that doctors have, right? The stethoscope, the otoscope, et cetera, the transilluminator to look into your sinuses. Those are all very, very important tools that a doctor can use to help, again, assess the situation. Aside from that, there should be enough time being spent where you're able to relay your symptoms. If you feel like you're getting that 60-second, one problem, one copay mentality, that should also send warning up your spine in terms of, is this the right person for you to be seeing, if they're not going to pay attention and listen to what your symptoms actually are. Because a lot of whether or not it's a virus, and a bacteria, or a fungus is in the symptoms that the patient presents with or has. And if the doctor's not taking time to do that, then that's just a warning for you that maybe that's just not the right doctor. Another thing that you should be being screened for, if we're suspecting, of course, there are different kinds of infections. There's upper respiratory infections, there's sinus infections, there's lung infection. We can get it, again, in the respiratory tract. That's what oftentimes referred to as upper respiratory. You can have a urinary tract infection. You can get a skin infection. You can have a gastrointestinal infection. So infections can happen, in many areas. And so again, the doctor should be looking for those clues and insights physically. Infections can present with rashes. Infections can present with part of the history, which is diarrhea. And a gut infection can oftentimes be chronic diarrhea. A skin infection can show up. Staph can show up in the skin. It can show up under the nail beds. Fungal infections can show up under the nail beds. Sometimes we can see signs of infection in the throat, and the tonsils are swollen. If you don't have tonsils, sometimes we see exudate along the back of the larynx, and that type of exudate can be indicative of excessive mucus. So there are a number of different, again, symptoms and clues that the doctor can look for. But if we're also asking the doctor to do more, we're asking the doctor to look at lab work, because sometimes the answer is in the lab work. So let's talk about a few different things that a doctor can do to measure the difference between fungal and bacterial. As a matter of fact, on that same note, there was a study done, published in the Journal of American Medical Association a couple of years ago in my area, which is Houston, the greater Houston area in Texas, that fungal infections were the greater cause for upper respiratory infection. In other words, fungus was a bigger cause of upper respiratory infection than bacteria, but antibiotics were the number one prescribed treatment for it. So there was a huge mismatch, and this study kind of shed a light on that. So what are some of the lab tests that can differentiate? Number one, we're talking about in the throat, we're talking about in the sinuses, a culture can be done. Doctors can run a swab into the deep sinuses or up into the back of the throat or in the mouth and send that out to the lab and differentiate. Now, to do a proper fungal culture, in essence, to rule out whether or not it's bacteria versus fungal, it can take a little bit more time than a traditional culture. In some cases, that fungal infection, to culture it properly and to really make sure there's not a chronic fungal infection, can take as many as 4 weeks to do that. Now, a bacteria can grow relatively fast. So again, you can find out, is it bacteria initially? Because if it's an acute bacterial infection, certainly you want to know that. You want to know how to deal with it. So the culture helps the doctor understand that. But there's a second part to a culture, and that's called a sensitivity, meaning a doctor can run a culture and sensitivity. In the sensitivity part of the test, if the culture comes back positive for a bacterial infection, then what the next step is that they can take your bacteria and expose that bacteria to different types of antibiotics. And in doing so, they can identify what antibiotic would be the most effective to treat your infection. In essence, culture to identify the bacteria, do a sensitivity, meaning we're seeing which antibiotics that bacteria is actually sensitive to, so that the doctor can be selective about which antibiotic to prescribe. Because sometimes what will happen is you do a culture, yes, there's a bacterial infection, but there is a resistance to many forms of antibiotics. And if the doctor just so happens to pick the antibiotic that you're resistant to, then you're not going to beat that infection. You're not going to win the war against that infection, and you're going to do the damage. Remember, antibiotics don't come without a cost. When you take an antibiotic, recent study, this was actually published, I want to say it was 2015, study published, found that one dose of antibiotics, one course of antibiotics can disrupt the gut flora for up to 2 years. Very, very important, because if you're weighing the risk versus the benefit, is that antibiotic going to save your life from an infection? Is it absolutely necessary? And if it is, don't hesitate. But if it's not, what are the other options that can be taken? Or if that antibiotic, there's a resistance and the doctor ran the right test, he's at least not going to do the damage of giving you the wrong antibiotic that won't work against that type of infection. So always ask for what's called a culture and sensitivity test. And so if you're getting that done, and that's the right move, culture and sensitivity. Now, another type of test that can be, and this is generalized, so you can ask your doctor to run this generally. If you're in an ER unit, if you go to one of these local ER facilities that are around the neighborhood, oftentimes they'll do this. It's actually quite common. A lot of the ER doctors are in tune really well with this, and they know to do this, but it's to do a CBC with something called a differential. Now let's talk about what that means. A CBC with differential is just a standard blood test. CBC stands for complete blood count. And so what they're measuring in this complete blood count is they're measuring your white blood cells, your red blood cells, but specifically they're differentiating what kinds of white blood cells and what ratios of white blood cells that you have. Because oftentimes a bacterial infection, your white counts will be high. Your total white blood cell counts will be high. But in particular, when they do the differential part of the test, what they're doing is they're differentiating which kind of white blood cells are elevated. For example, neutrophils, which are a type of white blood cell, are oftentimes the cell type that are elevated with a bacterial infection. So in essence, if your doctor said, look, I think it's a bacterial infection, and your blood work said that your neutrophil count was high, that's a pretty good indicator. That's a pretty good indicator that it is indeed a bacterial infection. If your neutrophil counts are not high, but they're low, and your lymphocyte counts are high, this is a pretty good indicator that it's not a bacterial infection, but that it can be a viral infection. So again, lymphocyte elevations can mean viruses. Another type of white blood cell is called a monocyte. This can also mean a viral infection. If you've heard of mononucleosis or Epstein-Barr, these are viral infections that oftentimes are accompanied with an elevation in the white blood cell type called a monocyte. So again, this CBC with differential can help a doctor to differentiate what kind of infection potentially it could be. Now, there's another type of white blood cell called an eosinophil. Now, if you've got elevation in eosinophil levels, this can be an indicator that, number one, it could be a parasite infection, because elevations in eosinophil counts oftentimes are caused by a parasite. Again, not a bacteria, not a virus, but a parasite. But also an eosinophil elevation could also mean that it's not an infection at all. Sometimes the symptoms of infection also are mimicked by food sensitivity. So if a person's allergic to particular foods, we can get elevations in eosinophil counts, and that can cause a low-grade fever and general malaise and fatigue and drippy, runny, watery, itchy nose and eyes, right? Very, very common. Allergy symptoms, very, very common to infectious symptoms. So if you don't have an infection, but you really have environmental allergies or food-based allergies, and the doctor's not differentiating with the appropriate type of testing, he'd give you an antibiotic, and again, it might not be necessary, and that might create a problem. So again, differentiating with a CBC and differential type of test, it's very, very standard. You can get a result back within a matter of minutes. If it's an emergency clinic, they usually have units that can test your blood and get you an answer back within about 30 minutes or less. So, that's something that you want to make sure you're asking for, because if you're not asking for it, again, you might be walking out with a prescription, an antibiotic prescription that you don't need. And remember, when you take an antibiotic, if you don't need it, it's not just about a safety precaution. It's about doing more harm than good and increasing the global concentrated problem of antibiotic resistance. So again, differentiation, culture sensitivity, CBC testing with a differential to analyze the difference between whether or not it's an allergy or a food problem, an external allergy like an environmental allergy, whether or not it's a virus, a bacteria, or whether or not it's a parasite. All very, very important, to have that conversation, those conversations with the doctor who's overseeing your care, and make sure that you're being directed in a manner that's consistent with keeping you healthy. So again, you can take that information to any doctor, and they should know what we're talking about today. This is not like advanced training. This is pretty basic stuff that pretty much all of your doctors should understand. So again, make sure you're taking notes, write this stuff down. Now, on a side note, I want to make sure that we talk a little bit about this other very important topic on drugs that suppress immune function, because many drugs that suppress immune function can lead to chronic infection that then can subsequently lead to chronic need for antibiotics and antifungals and other types of medications. And that, if you're taking drugs that suppress your immune system on a consistent basis, this could potentiate a big problem for you. So let's talk a little bit about these categories. And there's some basic categories. One of the categories of drugs that suppress immune function are the antihistamines. Now, a lot of times, you go to the doctor, you've got the sniffles, that maybe they give you an antibiotic and they give you allergy medication, right? If you look at a lot of the drugs over the counter, like if you go to CVS or Walgreens or one of these drugstores, a lot of the medications that are antihistamine in nature also have active ingredients that work as anti-fever agents as well. So they're kind of mixed bags. And so again, an allergy symptom can be the same as an infectious symptom. And so differentiating, again, very, very, very important. But antihistamines, if you're taking an antihistamine indefinitely, and I see people all the time in my office that come in and they've been put on antihistamine indefinitely. They're just said, hey, it's allergy season. for me, full year round, I'm just going to take this immune suppressing medication for the rest of my life, because otherwise I have watery, teary, itchy eyes, a runny nose, and allergy symptoms that are hard for me to deal with. Bad idea. Why? Because antihistamine, when you block histamine and you block leukotriene, which are the two primary classes of allergy medications that do this, you're actually creating the stage for a weaker immune system. And when you set the stage for a weaker immune system, you're predisposing yourself to infections of all kinds, whether that be, again, bacterial, viral, whether that be parasitic, doesn't matter. You're predisposing yourself to developing an infection when you inhibit your immune system's capacity to function on a day-to-day basis. And so if you're taking an allergy medication and you haven't been properly, in my opinion, if you haven't been properly tested for food and environmental allergies or chemical allergies, because many people that are on lifelong or really long-term allergy medications, if they would just change their diet, a lot of those medications become unnecessary, because it's not an issue of the fact that they're allergic to the environment so greatly. It's that their food is overwhelming their immune system to such a great degree that they don't have the immune capacity or reserve to deal with environmental allergies. And so they're reacting to everything in the environment because their diets are poor. And it doesn't even have to be food allergies. It could be a poor diet, meaning a malnourishing diet. A diet that's full of sugar, a diet that's full of processed food is going to suppress your immune system just as bad as some of these medications. So if your diet is poor, your immune system's not going to function properly. If you have vitamin deficiencies like vitamin D or zinc deficiency, vitamin C deficiency, your immune system's not going to do its job effectively. You're going to be predisposed. So it's not just, again, it's not just the medication, the antihistamine, but it's also poor diet, and it's also the classes of medications, going back to medications, it's also a class of medications that cause vitamin and mineral deficiencies. And so again, that brings me to the next one, which are antacids, things that block stomach acid. And a lot of people are taking these because they have the symptoms of reflux, or they have pain in the chest or heartburn. Now, oftentimes these people don't even actually have acid reflux. What they have is they don't produce enough stomach acid. But the symptoms are the same, whether you produce too much or whether you produce too little. The symptoms are the same, because too much stomach acid can cause an irritation, but too little stomach acid can also cause an irritation, because the food that you're eating doesn't digest, and it sits there and it putrefies and it irritates the lining of the stomach, and then it can regurgitate. So you can have the same symptoms whether you have too little or too much stomach acid. So differentiation, again, is very, very important. The doctor should be differentiating before just saying, take Tums, Rolaids, Nexium, Prilosec, Tagamet, or any of the other acid blocking medications. But remember, acid blocking medications, why is stomach acid important? Stomach acid is one of our barrier defenses against infection. We eat bacteria and viruses, we eat fungus all the time in our food. It's not uncommon to eat these things, but our stomach acid, the pH of our stomach, is designed to kill and inhibit many of these microorganisms before they can get down into our GI tract and populate our lower GI tract, or our small intestine and large intestine. So stomach acid's it's one of our major immune barriers. If you suppress it over time, you're going to potentially create an increased risk of infection, because the food that you're eating has bacteria in it, has viruses in it. You're not going to escape that component, but you want to protect yourself from that component by having a healthy quantity of stomach acid being produced. So taking antacids long-term, or history of antacid use long-term, will increase your risk for suppressing your immune system, predisposing you to infection, and predisposing you to the use of medications for those infections that might not be necessary if you went backwards and figured out why the problem was there in the first place. Another class of medications that suppresses the immune system has to do with pain control. So steroids. A lot of people get steroid injections or take prednisone or corticosteroids for injury or for chronic autoimmune pain. And these drugs are immune suppressors. What they actually do is they trigger an immune suppression that can predispose you to infection. That's not the only type of immune suppressing drug. We also have the biologics. So these are medications that block interferon, which is a type of immune chemical that we secrete. And again, these drugs suppress the immune system to such a great degree that they have black box warning labels on them that say, if you take this, you run a much bigger increased risk of developing cancers. Remember, you need your immune system to fight cancer. So if you find yourself in a bind where you're stuck with a disease that you're needing to have to go through immune suppression therapies, and the bigger question that I would encourage you to have a conversation with your doctor about is, well, how is suppressing my immune system going to fix the disease? It's going to mimic, or it's going to block the symptoms of the disease, but it isn't going to fix the disease. What can we do to fix the disease? What can we do to mitigate the triggers of the disease as opposed to masking the symptoms of the disease? Because when you mask the symptoms without mitigating the triggers, you end up in a much, much bigger problem down the road. So antihistamines, steroids, we have biologics, and we have antacids. These are just some of the general categories of commonly used medications that can suppress the immune system, increasing the risk for needing some of these medications or having to be prescribed some of these medications like antibiotics that then can lead to, again, the big global problem of antibiotic resistance. So all that being said, let's talk now, okay, that's what you need to know, right? You need to know what you can, we talked about what you could do to fight it, in essence, what types of conversations you could have with your doctor to prevent, so you were having the right testing done. We talked about medications, but what can you do? Like, what can you do at home to prevent the spread of antibiotic resistance? What can you personally do on your end? One is, instead of using a lot of these antibacterial soaps and, the lotions that people use, the Purells, actually one of my wife in graduate school, one of the things that they were required to do was a research study on whether or not those hand sanitizers actually worked. And what they found is they don't work at all. As a matter of fact, the hand sanitizers, the cultures that were done in people with post-hand sanitizers were actually more infected with microorganisms than the ones of people who weren't using hand sanitizers. So the hand sanitizers don't really work, but they contain agents like triclosan that can increase the risk of problems, cancer and other problems, but also they increase the risk of antibiotic resistance globally because a lot of bacteria at this point have already developed a resistance to that. So the more you use it on your hands, what it really does, what it really amounts to is it dries out your hands. It dries up the oil on your hands. Remember, the oil on your hands is an immune barrier. And that dries up that immune barrier on your hands, and it predisposes you to picking up infectious bacteria from your environment because your hand oils are drying out. So not a good idea to use those hand sanitizers. If you really want to wash your hand, use a nice caprylic-based soap, so a coconut-based soap, a glycerin-based soap. Those are probably the best ways for hand hygiene. You want to have good hygiene practices, obviously, at home and about. If you're getting out of an airport, if you're coming from a daycare, obviously you want to wash your hands. But around the house, sometimes people tend to be over-hygienic, meaning they wash too much. I've had patients that wash their hands so frequently that they were developing blisters and breaks in the skin because they were so frequently washing their hands because they were such germaphobes. But the problem was they had more germs than people who weren't germaphobes because they were destroying their immune system by overwashing. So remember, you can't overwash, you can't overshower. Every time you get in that shower and you use heavy soaps, you're washing off part of your microbiome on your skin, and you're washing off the oil. Both of those are immune barriers and protect you. So it doesn't mean don't take showers, but there is a balance. Some microbiologists, some experts in epidemiological disease say you shouldn't really take a shower every day. It's more along the lines of every 3 days or so, 2 to 3, maybe up to 4 days. And if you want to wash your private parts and the other parts, you can do spot washing. But there are many scientists that now say that we're too clean and that we're doing too much with soap. So something to keep in mind and to take into consideration. Other things that you can do, make sure that your nutrition is solid. If your nutrition is solid, if you're eating the right food, if you're not eating foods that you're allergic to that are distracting your immune system, if you're eating foods that contain a nutrient density that is conducive to good solid nutrition, then you're going to get the nutrients, the zinc and the vitamin C and the vitamin E and the other plant-based botanical nutrients that help your immune system do its job. If your diet, again, I talked about this earlier, if your diet is super poor, what ends up happening is you get sick not because of any other reason. You're eating like garbage. And remember, you've got to take some self-responsibility in this whole game, and you've got to make sure you're bringing in the right foods with good nutrient density in order to nourish your body. Your body needs vitamins and minerals. Those are the essential building blocks to strong immune systems, to healthy immune systems. And if you're not doing your part there, it doesn't matter about all these other things. All these other things are just surface if you're not doing your part by taking care of yourself. So make sure you're taking care of yourself with healthy nutrition. One of the things that you can also do is make sure that you ask your doctor about nutritional testing. Look, measure these nutrients. Measure to see whether you're deficient in vitamin C or zinc or vitamin A or vitamin D. Simple tests can save you thousands of dollars in healthcare bills. Simple tests can save you from getting very, very sick. Prevention goes a long way when it comes to prevention of disease spreading, especially infectious disease. So maintaining high quality nutrition. A lot of what we know about infectious disease is because the malnutrition that goes on in third world countries is so rampant. We see a lot of these diseases spreading in those countries a lot more than we do here, because generally here in the United States, people are not calorie malnourished, but they are nutrient malnourished, meaning that you might get enough calories, so you're getting adequate carbohydrates, fats, and proteins in the diet, but not getting adequate quantities of vitamins and minerals. And so keep in mind that these things can all be measured. They can be measured so simply, and you can put together nutrition that is very, very preventative if you've got a doctor who's in charge, who's really monitoring these things with you and saying, look, you were deficient in zinc, you were deficient in vitamin A, you were deficient in whatever it was, right? And then saying, look, this is how much vitamin A you need to take, or this is what food you need to eat more of to get that vitamin A, because there's two ways to approach it. You can approach it with food, you can approach it with supplementation, and sometimes you need to approach it with both. You always need to approach it with food, but sometimes you need to approach it with supplementation as well if you really want to dig yourself out of a major deficiency state. And depending on the person, I see some very, very frequently, I see some very, very severe malnourished states in people who are very sick, and supplementation is one of the ways that we can actually dig them out of those proverbial holes. So again, having the testing done is one of the best things that you can do in terms of being preventative and helping your immune system stay strong and be strong. Now, I talked a few weeks ago about immune tips, things that you could do to boost your immune system during cold and flu season. Go back and review that. That was just a few weeks ago. And those were, I talked more about advanced strategies in that episode of Pick Dr. Osborne's Brain. I don't want to belabor that point tonight. I want to take some time now to answer your questions as they're coming in. So again, if you've got questions, make sure you're typing those questions in so I can get them answered for you. Let's see here. Question from Vincent. Are there health benefits in using phages like LHO1, myoviridae? Yes. So what these are, phages are bacteriophages. Phage means to eat. So what these phages can do is they can gobble up bad guys. Now, there can be a benefit. Where I typically see a great benefit in adding these is where we have somebody with a very, very strong antibiotic resistant type of infection, and these can be used to support that. So think of somebody with, chronic C. difficile infection. It might benefit greatly with supporting their GI function with bacterial phages along with a probiotic. In these cases, I like to use a spore-forming probiotic or spore-based probiotic, but good question. Let's see here. Oh, Misty Rushing. Hi, Misty. Nice to have you aboard this evening. Okay, so question is, many people in the scleroderma group using an antibiotic protocol described in the Roadback Foundation. Yes, I am familiar. My thoughts about it are this. Look, I always recommend not using generic antibiotic use just because. People might find a benefit, but they don't necessarily know why they're finding a benefit if the right kind of testing hasn't been done to precede the use of those antibiotics. Look, antibiotics, many people with chronic scleroderma, which is an autoimmune disease, have an infection. It's one of the triggers for autoimmune disease is infection, and bacterial infection is one of those triggers. It's because bacteria can create endotoxins that can leach into the bloodstream and create systemic problems with immune regulation. So antibiotics in some of these cases, yeah, it can be helpful. But again, my advice is not just here's a protocol for antibiotics because this is what we do for everybody, but let's first analyze whether or not antibiotics are going to be helpful and useful and the right move in these individuals, because it can contribute to antibiotic resistance. Yes, it very likely could if antibiotics weren't necessary in a particular person's case. Let's see here. Suzanne Jimenez, what is the best recipe book to get to help with MS allergies? I don't, if you mean MS, do you mean multiple sclerosis, Suzanne? I'm not quite sure what you mean by MS. Is that an abbreviation or is that just a typo? Is that really with my allergies? Look, the best cookbook I can recommend is the one on the shelf behind me, No Grain, No Pain, 31 recipes. They're some of my family's favorite, hands down, 31 of the best recipes that you'll ever cook in your kitchen, and healthy and good for you as well. Beyond that, it depends, Suzanne, because it just depends on what you might be allergic to. Before I would recommend a bunch of recipe books, I would really recommend allergy testing as a precursor to making a piece of advice, because you might be allergic to certain things in a lot of recipes, and that would be a much more helpful piece of information so that you can pick and choose. Let's see here. Ann Palacios is asking, in terms of wheatgrass and barley grass and gluten sensitivity, can they be okay to consume since they are just grasses and do have the gluten protein as of yet in them? So I don't recommend the grass-based drinks that people do, like the wheatgrass juice, the oat barley grass juice, those things. I don't recommend them because the cross-contamination issue is a big, big problem. Let's see here. I don't recommend them to such a great degree that we formulated a green drink without grasses on purpose. We did that because again, the problem with a lot of these products is that they're cross-contaminated. I'm going to put up a link to that for you guys. It's called Ultra Food, and so if you're interested in a green drink but you want it without all the grain-based grasses in them, where you could have that risk of cross-contamination, this is what I recommend. Beyond that, I just don't recommend. I don't recommend the others if they contain those grasses, because you just don't know about cross-contamination, and so many people are just so sensitive even to grasses. As a matter of fact, I think at last analysis, it was somewhere in the neighborhood of 30 to 40% of people in the U.S. are allergic to grass. So using grass as a drink, sometimes not the best idea. Let's see here. Let's see, another question coming in. After C. diff and surviving it, especially elderly people, what probiotics do I recommend for them? In the hospital, very hard to use natural soaps. I have to wash my hands a lot. Look, I recommend Biotic Defense as a baseline probiotic. Biotic Defense. It's a blend of hardy probiotics that are very resistant, and so they tend to populate the GI tract very strongly and very well. Again, it's called Biotic Defense. I have different versions of it for different reasons. If you look on Gluten Free Society, and just type in Biotic Defense, you'll see there's several different varieties there. Just for maintenance, just the straight Biotic Defense. If you're talking about for much, much stronger dosing, much bigger types of issues, you should use the Ultrabiotic Defense. It's just a much stronger dose of bacteria that it can be very, very helpful. Okay, next question. This is a big one. Is the flu shot okay? Look, if you think it's okay to inject yourself with mercury and aluminum, then yes. No, not really. I say that, sarcastically. Look, I don't recommend the flu shot. Now, this certainly is a conversation you want to have with your other doctor, or with your doctor. But look, what does the flu shot really do? We just got a new study that came out that said people that get the flu shot are twice as likely to develop the flu in following years. We know the flu shot cannot work in 100% of cases, and very rarely does it actually even work. So the risk of injecting mercury and aluminum in your body at the potential benefit that it might work, that the CDC might have picked the right strains of the flu virus this year, that to me is a pretty big risk. considering that aluminum is an immunosuppressant and can trigger autoimmune disease and has been linked to dementia, considering that mercury is a known neurotoxin, and not to even consider the formaldehyde that's in there, or the other ingredients, same ingredients in the flu shot are used to make antifreeze. So these are things, they're called adjuvants. They're designed to irritate your immune system on purpose. And I just don't think that's a really great idea, especially for those people struggling with chronic autoimmune disease who are already immunocompromised. I don't think it's a great idea. But again, that's going to be a conversation you need to have, with your doctor as well. Okay, let's see here. Christina, allergic to both those grasses. Oh, you're welcome, Christina. I'm glad that was helpful for you. Let's see here. So somebody in Canada is chiming in. Marla in Canada is saying that they announced on the news that it was the wrong strain this year. So in essence, the flu shot was a no-go in Canada. Not that it didn't get delivered and dispensed, but that it just didn't have an effect. I agree with Carla. Never had a flu shot and don't want one. I agree with the don't want one, although I have had them. I was in the military years and years ago, and we didn't have choices then, and they inject us with more chemicals than you could imagine. Lisa, I want to share her experience. I've never gotten one until this year. I'm 39, had shingles last month, 3 months of sore throat and cold before that. Yeah, that when I was working in a family practice when I was doing my graduate work, and what I tended to see was people that would come in and get the flu shot. And again, this is just my experience. They would be back a couple of weeks later complaining of symptoms of the flu. So that was more the common outcome of that in my experience than anything else. Let's see here. All right, I think we got them all tonight. So as we're wrapping up, a couple of closing things. If you are not subscribed to our feed, make sure that you visit us at glutenfreesociety.org. Sign up for the newsletter. Make sure you're on getting the information from us so that we can keep you updated and we can send you the reminders. First of all, the reminders when we do the show, and reminders on where we archive the show. So if you're interested in watching past episodes, make sure you subscribe. We'll send you that information where to find it. We also send you a nice gluten-free survival kit, and that's no charge to you. Just sign up on the newsletter. So again, if you're not signed up, make sure you go there, glutenfreesociety.org, and do that. Also, want to make sure those of you listening tonight, share this information with somebody that you love. You know somebody who's struggling and chronic recurring infections, especially the moms that that might have kids with chronic ear infections. They've got tubes that have been inserted in the ear. Share this information. You might just be giving them information that could change or save a life. And together we can share this, and we can help, and we can save more people and change the world in a bigger, better way. So thanks so much for tuning in tonight to the Dr. Osborne Show. And we will be back again next Monday evening, 6 p.m. Central Standard Time. We'll see you then. Have a great night.